Sexual health is something that is very integral to our overall well-being. And for a lot of men, sexual health is very much put on the back burner as they're getting their transplant, and for several months thereafter because of concerns about health risks. And it's something that we forget about. And if you are in a relationship with a partner for whom you have had a meaningful sexual relationship for months, if not years, it becomes a loss. And that loss often tends to spread out into other aspects of your relationship in your life. And it's because of how slowly that occurs, not something people think about as much as they should. And so in terms of common issues that a man after transplant might experience, he may experience lower libido or desire to have some form of sexual encounter. He may also experience some erectile dysfunction. And there may be also some changes to the relationship with his partner that he's not really aware of. So these are all things that you can think about as there being both a medical and a psychological and a relationship component to that we try to work with patients together to be able to put those pieces in the right place. I think a major psychological component comes for men, particularly if they've experienced some form of erectile dysfunction post-treatment, or even if because of age they were already starting to experience some erectile dysfunction. For men, it becomes often a loss of the sense of who they are because they've been able to successfully develop an erection for decades to that point often. And when you lose something that's so core to who your sexual identity is, it really is potentially a life-changing factor that makes you less likely to pursue sex or engage in even physical contact with your partner. And so understanding how that impacts a man's psychological makeup and well-being, especially in the context of maybe other mood disorders like depression, is something that men should be thinking about with their providers.